Namaste friends, welcome to my channel. Today we'll be discussing on a topic that is ChatGPT Health. This is a application which has been launched by OpenAI for the patients to check their health, check the status of their health. You know that artificial intelligence is really coming in a big way, and India is also participating in also a big way. Next year, month, that is in the February, there is a global summit on artificial intelligence. Now, I want to discuss about this Chat GPT Health, not only specific to Chat GPT Health, how the artificial intelligence will change or affect the patient behavior and what it could mean for doctors, how the doctors should probably and how to adapt with the changing times. Now, we do produce many records and give it to the patients. Patients can scan them and upload to these applications like ChatGPT Health, which is the one which has been launched. Of course, the its access right now is limited only to the US citizens. Sooner it will be available to Indians also. It's not just limited to ChatGPT Health. There will be many applications. Even Google also may launch, and to a certain extent, a notebook LLM, what we are seeing, can be also be used in this fashion, but specifically designed and trained to handle the medical data for the patients and to give an output which is understandable to the patient in the patient's language. That the strategy with that strategy, the applications will come. And when you we are giving so much patients that we are supposed to give them, and patient will have the data, the all the diagnostic reports and everything. Now these patients can upload it and upload into their health application, and when they upload with the health application, there will be it can have a bigger context from giving right from the all the health records, so it can mean a lot to the context of the output, so the patients can better derive the what do you say, the meaning of their health history, and they can understand more about that. Now we have to understand, when patient has learned so much and when he comes to us, we got to be prepared for what the patient may ask, because the patient who is has seen and he would definitely come out with more information, and will be expecting more information from us, and they will be expecting they'll definitely participate in a discussion for their treatment course, and they will be more learned in that case. Of course, I do agree the patients may get misinformation or go out of context or overestimate or underestimate. This could happen, but we can't stop that. None of us can stop what is going to happen, because intelligence, artificial intelligence, will come and will definitely be a part of the our life. That is going to happen. Now, when patients are coming with informed information, which he has understood, all is past. So we got to explain them in a different way, probably in a more efficient way. And I personally feel it will be helpful to us to, because patients would already know, we need not spend or waste time in swallowing simple or basic issues. They will understand that, and they'll already knowing it, and they will be able to take a decision if there are some ifs and buts in a treatment course, because many of the diseases are like that. The options of treatment will be many, and sometimes the diagnosis itself will be at confusion. In such a way, the patient will understand us also what is the real problem happening. So this is a patient side what is will going to happen. Now let us look at in the Indian perspective. The government of India has launched National Health Authority, that is, it has launched Ayushman Bharat Digital Mission. And when we have Ayushman Bharat Digital Mission, which will create a records in a very interoperable fashion. Now any hospital can upload their records and the patient can access it, so the patient will have the more detailed vertical and across multiple hospital records which are linked to the Ayushman Bharat Digital Mission. They can access it through ABHA. Now, if the ABHA or a patient side apps start integrating with such artificial intelligence systems, So you can imagine the patients will be able to get the understand about the illness much more efficient. Probably this will be the one in the case in the whole planet. Whatever US is doing, they don't have such an Ayushman Bharat Digital Mission. Of course, their HMSs are much more advanced than us, but their interoperability is also at a problem for them. But in India, with Ayushman Bharat Digital Mission in place, so this longitudinal records of the patients becomes very easily available, and implementation of artificial intelligence on the patient side will be much more efficient and much more faster than anywhere in the planet. This is going to happen now. What does this mean to us? Definitely, we are, of course, in India, the implementation of electronic medical record is definitely less. More doctors, most of the doctors don't use electronic medical record here comparing to the West. We still go with pen and paper only. That is a trend in India still. But with changing times, with voice activation, that's one more thing I want to tell in the next month. The basic global summit, that is or Indian LLMs, the main focus is on the voice assistants. Now, when the voice assistants becomes much more uh, easily accessible to us, the HIMS providers will definitely create the voice enabled HIMSs for us. So, and we are also planning to implement in our nice HMS. That's it, voice assistants. And certain extent we have done it, but we want to go it in a bigger way. So these voice assisted HIMSs will generate medical records much more easier for the doctors. So naturally, the medical records will become digitalized, and they will be accessible to the Ayushman Bharat Digital Mission. Through that, the patient integration will be more, and artificial intelligence upon that, you can imagine, will be much more efficient in our systems. So I personally feel this change, what is happening here, we should change behavior in ourselves. We doctors, we need to start digitalizing our medical records. That way, we will be future ready, and it won't be like optional. Slowly, although it is not compulsory, but it would force us to go for electronic medical record. We will start. We should start digitalizing our medical records, and it is going to happen. And what do you think? I wanted to know from your side. What do you think? Where how this artificial intelligence is going to affect the patient's behavior? Will it create much more problems, or will it create legality issues to us more, or how should we change or modify our practice with changing times? If you, I wanted to know your opinion in the comment section. Please do comment and subscribe to our channel. Thank you.